for Medi-Cal. We're talking about the people who have too much money to qualify for that, but not enough to afford health insurance. That's 47 million Americans. That's a huge number. And then you look at another 100 million Americans that are underinsured to the point where if they had a major illness, they would go bankrupt. And today, 62% of all bankruptcies are for medical reasons, for medical debt. So now that we're talking about health care reform that puts up a public option or universal health care, the insurance industries are crying, oh, you shouldn't do that. This is America. We need free enterprise. Give us another chance. Trust us. We'll do a job that's really good. Well, my answer to that is you've already had your chance. You had the opportunity to give a service, and you preferred giving $100 million bonuses to some people who are CEOs, and in cutting services and keeping people from being able to get the health care they need, and creating long lines. We talk about long lines. Yeah, there are long lines, all right. It's not just in Canada and other places where there's universal health care. It's right here in this country where you don't get health care at all. That's totally unacceptable. So I say universal health care is what we need. It's not the most ideal way to do it. I'd love to see free enterprise involved with that, but can you trust them? The answer is no. They've already shown us their colors, and now they're crying that they want us to give a second chance, and not crying too loudly because they have the economic impetus to coerce Congress into doing what they want. Why do you think the Democratic Party is not able to stand fast and pass bills that should be an automatic when you've got dominance in Congress? It should be straightforward. A lot of those people are accepting basically bribes, in my opinion, from the insurance industry to be able to buy votes in Congress to stop we the people and our leader Barack Obama from doing something to give us a health care system that we need. That needs to be made clear. Do you really want to give these people another opportunity to be able to maintain business the way it is? We don't even now have a public option, let alone universal health care or something that's in between. We don't even have a public option because that's maybe not going to be on the table. That's totally unacceptable. Again, it's big business, the insurance industry, manipulating Congress to not even put a bill on the table that we the people can vote on. Is this a democracy? Or is this something that's a corporate democracy? We've lost the democracy that we need, and that's what's happened to us. Big Pharma is another example that's just the same. We've got the problems there that are terrible. They are clearly out to make money as their first objective. It's not to provide you service, but if they can provide service, they will, because obviously we'll buy the things that work. When we look at some of the issues that are in this book, A Return to Healing, I document from the mainstream medical literature, from places in the mainstream that looks at all the pharmaceutical industries and what they're doing to try and make sure they get profit. They're lying to us. They're keeping information from us. They're producing information that's manipulated and presented in a way that's not factual. They've got direct-to-consumer ads that are telling us things that are not true. They are trying to convince us that they have the answer for all the diseases that there are. That's hogwash. They don't. I've been a doctor for almost 40 years. I'm board certified in internal medicine. I've been doing this for a long time, and I know it very well. And when I stepped out of that paradigm, and I've looked at what's happened in healthcare because of the influence of Big Pharma, I'm very dismayed. We've gotten away from wellness and prevention. We've been hoodwinked into thinking that we need every drug that comes out, particularly the new ones. And just to give you an example, even though there are many in this book, one is the case of Vioxx. This is a drug that's in a family of drugs called the non-steroidal anti-inflammatory drugs. They're drugs that are used for pain, to reduce inflammation. Well, back in 1995, when Vioxx was being studied, the pharmaceutical company that made Vioxx knew full well that it was causing problems in the range of problems in terms of heart attacks and strokes. They kept that a secret. They withheld it from the FDA. It's one of the times the FDA is not guilty for doing something that you would think that maybe it was in conspiracy with, but it wasn't. In 1999, the drug came out. By the year 2004, there were probably 40 or 50,000 deaths caused by this drug. Graciously, the drug company decided that they would take the drug off the market because the FDA was no longer in a place where it could continue to support it. Too many doctors were finding out that there was a problem. So they took it off the market. Now, they figured that they were going to get sued And they knew that back in 1995 that this was a problem. And all this information is public record now, so it's not me, Dr. Len Saputo, coming up with this information. This is information that's public and published in places like the New York Times. They knew that was going to happen because they had the information already. They realized that they would lose something to the tune of $5 billion in lawsuits. But they also knew they'd make a lot of money, and they did. They made about $12.5 billion. So this was a sweet deal in terms of business, but I call it outright murder. I think it's something that the pharmaceutical company knew. They did it deliberately. It was a business proposition. They're getting away with murder. And now they're complaining and offering pittances to us in terms of a compromise so that they can lower health care costs by lowering drugs a little. But they aren't really serious about trying to help us. If they were serious about trying to help us, they would charge us the same thing that they would be charging other countries where they're selling drugs, like Mexico and Canada and overseas products. And that's why many Americans now are going to Mexico to get their health care and to get their drugs. It's not a very nice arrangement. So when we're looking at health care reform, we the people have to take a bold stand. We have to look at the impact of what's happening because of the insurance industry's indiscretions and big pharma's lack of conscience, and that's an absolute must. And that ramifies deeply into the medical profession. Now you're looking at the impact of the research that's put out by big pharma, that's regulated by them, that's interpreted by them, and sometimes even written by their advertising departments in order to help them compete with other drugs that are on the market, not by their research departments. That's called ghostwriting. And they're interpreting the data the way that they want to. And so the information that gets published you can't trust. And that's, again, it's not me saying that. There are people like Marcia Angel, who was the chief editor of the New England Journal of Medicine for 20 years. And people like Ushma Neal of the Journal of Clinical Investigation, who quit their jobs. These are physicians, editors-in-chief of these major peer-reviewed journals that are icons in the medical industry and medical profession, and they quit their jobs saying they're disillusioned, dismayed, disenchanted, and want nothing to do with it. These are people sometimes from Harvard. So it's a big deal when your doctor is getting information that they cannot trust, even though it's published in peer-reviewed journals. Another example of what's happening at the deepest level that's impacting us to a large extent when it comes to health care, and it's why we need health care reform. Then you look at medical education. Is medical education what it should be? Are we teaching our doctors what they need to know? Or do we have a paradigm that makes the most sense in terms of how aggressive we get? And again, the answer is a clear no. We're teaching in our medical schools what the big pharma wants to teach us, and the reason that we're doing that is because they're funding the studies that are bringing money into those medical institutions, allowing them to be able to survive financially. So our medical students are learning the information that the senior staff is publishing. They are taking that as though it's factual, and sometimes it is and sometimes it's not. Far too often it's not. And there are many articles out there talking about how much solid science there is in medicine. It may not be the number you think. And in the book I describe articles that are talking about this, and it's in the range of about 15%. Not 85% where it's good information, 15% where the stuff is good information. So we have a challenge here that's big time. We're corrupt at the level of Congress. It's responsive to big pharma, and it's responsive to the insurance industry. They're affecting the research industry, they're affecting medical education, and they're affecting the choices your doctor is making when you get your care where your life may depend on that. That is not acceptable, and we need to do something to take back our responsibilities. I don't know that we're going to get our Congress to do something about it. I hope Barack Obama can.